Did you know that pregnant women in the last trimester of pregnancy can have a low platelet count? Today, I would like to talk about reasons of a low platelet count in pregnancy because this is a very common consultation that we as hematologists get. We see a lot of pregnant women being referred by gynecologists for a low platelet count, and the general approach would be to begin with which trimester of pregnancy is the low platelet count seen in. We have various diseases which can be associated with a low platelet count in pregnancy. The most benign cause of a low platelet count in pregnancy is something that is called gestational thrombocytopenia or physiologic thrombocytopenia of pregnancy, in which we see a lot of women, I would say more than 70% of women, they come close to delivery with a platelet count that is as low as 80,000, 90,000, maybe 1 lakh, and it is a reason for great anxiety among mothers and husbands and their families. So this is a very benign cause, and most women, I would say 60-70% of women, especially late in pregnancy, they can have a low platelet count and generally nothing needs to be done about it. Whereas if we see a pregnant woman who comes with a low platelet count in the first trimester of pregnancy or maybe in the second trimester of pregnancy, these patients are a little more difficult to handle and the reasons are quite different. Coming to reasons of low platelet count maybe earlier in pregnancy would be ITP. There could be other reasons as well, but one of the commonest causes is immune thrombocytopenia, in which there is platelet destruction, and generally by giving steroids we can tide over this and normalize the platelet counts if we see a low platelet count caused by ITP earlier in pregnancy. Towards term, if we see a low platelet count, then we need to be mindful of other conditions like HELP, which is hemolysis, elevated liver enzymes and low platelets, and apart from that, pregnancy induced hypertension, preeclampsia. These are all conditions which can be associated with a low platelet count late in pregnancy. So I would just like to say that the commonest cause of a low platelet count in pregnancy is physiologic thrombocytopenia of pregnancy, which is seen close to delivery. Whereas if we encounter low platelet count maybe earlier in pregnancy, we need to think of other causes like ITP, thrombotic thrombocytopenic purpura, and maybe HELP syndrome. Thank you.